அனைவருக்கும் மதிய வணக்கம். வெல்கம் by TANSACS, Tamil Nadu State AIDS Control Society. The topic is the last mile challenges towards elimination of HIV. Last mile. With the resilient public health system, we will cross the last mile. We will reach. HIV facts, everybody knows. It's an weakening the immune system. There is no cure, but we got treatment, antiretroviral treatment. It is a manageable chronic condition like diabetes. That's the world scenario. Nearly 4 crore cases, 4 crore ALHIV, people living with HIV are in the world. In India, the 25 lakhs. Trends in Tamil Nadu, we are in the decreasing trend. That's why the topic is a last mile challenge. It's a prevalence rate. We are in the verge of elimination from 0.84 to 0.2. It's a prevalence rate in adult. We are nearing the elimination phase. So ANC clinic attendance, it will be taken as a proxy indicator. Compared to national level, we are in the very low. There is 0.16% in the antenatal attendees. That's a proxy indicator for general population. It's a national AIDS control program. We are in the 5th phase. This is all the program NACP goals, reducing the annual incidence of HIV infection by 80%. Mortality, death rate should be reduced by 80%. Eliminate the vertical transmission of HIV syphilis. Promote quality access to RTA, STA service. Then eliminate stigma. என்ன அப்படின்னா நம்மளுடைய டார்கெட் வந்து 95 95 95 95ங்கிறது யார் யாரெல்லாம் ஹெச்ஐவி இருக்க பாசிபிலிட்டி இருக்கோ அவர்களுக்கு 95% we should have a diagnosis. We should test for HIV positive people and we have to identify the 95% of the estimated target. And all the diagnosed HIV எல்லாருக்குமே வந்து we have to start antiretroviral treatment. அதில் treatment success, that is the suppressed viral load. Viral load எடுத்து பார்க்கும் பொழுது it should be suppressed. That is a 95-95 target. இதில் தமிழ்நாடு எங்கே இருக்குது அப்படின்னா ஃபஸ்ட் 95ல 94, செகண்ட் 95ல 90, தேர்ட் 95ல above 95. We are in the verge of elimination. We are in the last mile of elimination. இந்த டார்கெட் அச்சீவ் பண்ணுறதுக்கு நம்மளுடைய ஃபஸ்ட்டு டார்கெட் அச்சீவ் பண்ணுறதுக்கு கம்யூனிட்டி பேஸ்டு ஸ்க்ரீனிங் அண்ட் டெஸ்டிங். அடுத்து இண்டெக்ஸ் டெஸ்டிங். இண்டெக்ஸ் டெஸ்டிங்கிறது பாசிட்டிவ் பர்சனுடைய கான்டாக்ட், அவருடைய பார்ட்னர், அவங்கள டெஸ்ட் பண்ணுறது மூலமாக அந்த 95% அச்சீவ் பண்ணணும். நெக்ஸ்ட்டு வந்து ஏஆர்டி. அதில் என்ன அப்படின்னா டெஸ்ட் அண்ட் ட்ரீட் பாலிசி. யார் யாரெல்லாம் வந்து பாசிட்டிவ் ஐடென்டிஃபை பண்ணியிருக்கோமோ அது உடனடியாக வந்து அவங்களுக்கு ஆன்டி ரீட்ரோவைரல் ட்ரீட்மெண்ட் கொடுக்கணும். இன்டென்சிஃபைடு எல்எஃப்யூ ட்ராக்கிங், லாஸ்ட் டு ஃபாலோ அப். யார் யாரெல்லாம் வந்து ட்ரீட்மெண்ட் எடுத்துகிட்டு வரலையோ அவங்கள தேடி பிடிச்சி வி ஹவ் டு ஸ்டார்ட் ஆன் ட்ரீட்மெண்ட். எதற்கு? டு சப்ரஸ் தி வைரல் லோட். வைரல் லோட் சப்ரஷன். வைரல் வந்து அதனுடைய லோட், வைரலுடைய காப்பீஸ் டு பி சப்ரஸ்டு. அடுத்து வந்து டிஃபரன்சியேட்டட் கேர் டு இம்ப்ரூவ் ரிட்டென்ஷன். டிஃபரன்சியேட்டட் கேர் மீன்ஸ் வி ட்ரீட் தி சப்ரஸ்டு வைரல் லோடு பேஷண்ட் அஸ் அண்ட் விஐபி இன் ஏஆர்டி சென்டர். அவர்களுக்கு வந்து வந்த உடனே 3 மாதம் மாத்திரை கொடுத்துட்டு அனுப்பி வருவோம். அதுதான் டிஃபரன்சியேட்டட் கேர். அதாவது சப்ரஸ்டு வைரல் லோடு இருக்கவங்க வந்து விஐபி பேஷண்ட்டு. These are all the service delivery by TANSACS. அதை ஒரு 87 CBO, கம்யூனிட்டி பேஸ்டு ஆர்கனைசேஷன். அடுத்து 17 லிங்க் ஒர்க்கர் NGO. இவர் எல்லாமே வந்து ப்ரிவென்டிவ் ஆஸ்பெக்டாக தே ஆர் ஒர்க்கிங் ஃபார் ப்ரிவென்ஷன் ஆஃப் HIV. அண்ட் ஸ்க்ரீனிங் 3163 ICTC சென்டரில் we are screening for HIV. Then 80 ART center for treatment. 58 government health institutions, 22 private colleges. Along for treatment. Then 172 link ART center for treatment nearer to the place of residence. This is all service delivery by TANSACS. Then tracking back defaulter. ART ஆரம்பிச்சு வராதவங்களை தேடி பிடிச்சி வைக்கிறதுக்காக 32 CSE அதுவுமே வந்து it is run by the positive people for the positive people. Then 34 drop in center அவருடைய சோசியல் வெல்ஃபேர் ஆக்டிவிட்டீஸ்க்கு லிங்க் பண்ணுறதுக்காக 34 drop in centers we are having in Tamil Nadu. These are other lab, state reference lab for viral load testing. National reference lab we are having in our Tamil Nadu. Then U equal to U. This is a concept we are promoting for IEC. It means undetectable viral load means it is untransmittable infection. When we achieve undetectable viral load, viral suppression, then the disease will not be transmitted. That's why that is we want to break the chain of transmission. That is we want to have a zero HIV. These are all challenges. We are having many challenges. Many of the patients are identified only in the hospital in the inpatient. We need a field identification we have to improve. In the hospital, later stage, we are diagnosing only in the later stage. Then there are issues in partner identification. For index testing, we have to identify the partner. Due to stigma, we are having issues in index testing, partner identification. And another challenge is a surge in MSM activities. MSM means man sex with men. இதில் என்ன ஒரு ஃப்ளானா people have a heterosexual contact மூலமாக தான் HIV பரவுது. MSM is safer அப்படிங்கிற ஒரு தாட் இருக்கு. The recent evidence suggests that HIV positive is more in the MSM persons. Then social media addiction. There are so many dangerous apps for the MSM activities, for the sexual activities. There are so many dangerous apps. We have to restrict our this generation and future generation with the apps, dangerous apps. Then linkage losses. Linkage loss means screening site to confirmation site. We have some loss. ICT center to ART center. Treatment aspect we are having loss. We have to follow the loss to follow. Even after starting the treatment, there are some patients are lost to follow up. And after out, they are diagnosed, they started the ART, then they don't want treatment. And the treatment in private sector. The after-out cases may have got treatment in private sector. The treatment protocol in private sector, we are not whether it is up to the national protocol or not. And the reporting, there is a backlog. We have no report from the private center. And follow-up of the last follow-up cases, we are facing very challenges in the private sector. These are all the services towards the HIV elimination. The intensified IEC campaign. We are with so many materials, medias, social media, mid-media. We are having the intensified IEC campaign for promote awareness. Then targeted intervention. Very many NGOs are involving in the targeted intervention. It means so many groups, migrant, drivers, truckers, and female sex worker, male sex worker. Everybody, we are having separate NGO. They are working for them, for diagnosing, for giving awareness. The link worker scheme. That's a rural-based high-risk group. We are having 17 NGOs working for that. We are having mobile ICTC and Sambhurna Suraksha Kendra. There's a one-stop center for delivering all such HIV services. Then integrated health camp. We are conducting the integrated health camp in remote areas. Then convergence with the TB, RCH program, NCD program for better life of the PLHIV. The next is the early HIV screening in pregnant women. We For preventing the vertical transmission, we have to do a early screening for pregnant women for HIV. Then we have to ensure the prophylaxis for newborn. Then community empowerment through PLHIV network. We are empowering the PLHIV people through NGOs. And so stigma and discrimination reduction. HIV is a stigma, having its own stigma. So we are sensitizing all the healthcare provider for stigma elimination. The workplace policy. Workplace policy means workplace there should be an complaint officer. Then community campaign to normalize HIV screening. Then involvement of PLHIV in peer support. We are having even in our ART center, community care coordinator, this is the PLHIV. We are involving the PLHIV in day-to-day work. Then legal and policy framework. In 2017, we have a HIV Act to promote to protect the rights of HIV affected people. We are having the HIV Act 2017. And we are having, these are intensified IEC campaign for promoting the IEC activities. We have started the intensive IEC campaign with our Honorable Health Minister and respected Health Secretary sir and DPS sir attended this intensified IEC campaign activities. These are the awareness materials we have prepared. These are also the awareness materials we are for displaying in the public health institution. We have conducted an online quiz program. For every district we have conducted online quiz program for HIV AIDS, and we are conducting the intensified IEC campaign in village for village level awareness creation. For HIV affected and infected children, government of Tamil Nadu is giving ₹1,000 per month. This is a way forward. We have to ensure every child the best possible start in life. That is, we have to prevent the future generation from HIV. So we have to sensitize all women of reproductive age group, especially for the PLHIV women, regarding the HIV treatment, viral load suppression. Then strengthen the last mile service through integration of HIV program with other public health platforms. Then sustain high ART coverage and viral suppression. Then we have to extend the community ownership through NGOs, network and peer educator. With these efforts, we will definitely, with the coordinated effort, we can achieve the target of 95 by this year end and eliminate HIV as a public health threat by 2030 with all our sustained efforts. Thank you all. Nandri.